There are essentially two scenarios whereby trauma can affect your veins. The first scenario is that you have no visible veins, but you've had trauma, and then in a period of 6 months, maybe even 1 to 2 years, you've noticed varicose veins in that area, especially if it was on one leg. Now, the reason this occurs is because the vein that gets damaged is only about 1 to 2 centimeters below the skin, especially on the inside of your leg. Now, if you have an athletic build, it might be 1 centimeter or even less than that, and therefore it can be damaged quite easily. And once the valves get damaged, it then causes varicose veins. Now, another scenario is that you've had trauma and potentially had a fracture and maybe needed surgery. A lot of times people feel that the surgery may have caused the varicose veins, which is very less likely, especially in this day and age, and it's often the trauma itself or the fracture that you had sustained that caused the varicose veins. Now, a very important point is that a lot of times people would feel it is trauma that caused these varicose veins, but then it might be genetic after all, because sometimes they may have had trauma in one leg, but they might have varicose veins in both. So it's really hard in those scenarios to actually pinpoint exactly which one came first.